Hey guys, Dr. Sean here. Good morning today. We're going to talk about something, a new article just came out this week. It was in Modern Healthcare talking about the soaring costs of drug prices. Now, we've talked about this many times before in the past, how you see all these guys in the news getting brought under indictment and things for excessively inflating the costs of medications and things to patients who are really in need. How big of an issue is it? How big of a problem is it? What are we really looking at here? So I thought I'd just run through this with you, and I thought it'd be kind of fun. 12% of the healthcare dollars that are spent in this country go directly to prescription drugs. Now we look at that and say, well, what does that mean to us? We spend $4 trillion on healthcare in this country. So when you start looking at it, you think, all right, that's a lot of money, right? Hundreds and hundreds of millions and billions with B dollars that we're spending on healthcare. Now, what do we get for it, right? I was recently on the World Health Organization's website going through and I looked up the United States. We are about 37, 38 this year for healthcare overall globally. Now you look at that and think, all right, so of all the countries in the world, we're in the high 30s, almost 40 for where we rank globally. And I look at that and I think to myself, gosh, we spend a lot of money on healthcare. We spend more, double the price of any other nation in the world. We're number one for what we spend. And I look at that and I think to myself, okay, so we're spending more, but we got a crap product. And so the question then becomes why? And so I'm reading through this article and we're discussing drug costs and all the things that they do. And it's amazing to me because I don't know that you guys know this and I thought I'd bring it to you today. The inflation over the past 20 years, yearly average has been 3.22%. Drug companies alone in 2015 showed a 17.1% growth in profit. They've grown every year over the last 20. They're expected to have a down year where they only grow about 10% in 2018. I mean, I don't know about you, but if you invest in the market or this or that, you get 7, 8, 9% growth. That's considered exceptional. You're getting 17% growth in profit. It's unbelievable. And so we look at this and we say, well, why is this happening? Well, here's one of the reasons. We don't buy direct. So you and I as consumers, we don't buy our prescriptions. We don't buy our meds. Our insurance company takes care of it, or the government has some little step in there. So we never really see the prices. So they're kind of hidden. And by the time it gets back around to us, where the government's dealt with it and the insurance has dealt with it, and now your employer, and they're passing it back on to you, you don't see it. All my premiums are going up. All my things are going up for my insurance. It's a problem, guys. It's like being a child again. When we're a little kid, we don't realize the cost of $1, right? We don't really know, hey, Mom, can I have this toy? Hey, Mom, can I have that? We don't really get it. But this is what's happening to us with our health care. And it's what's happening to us with these soaring costs of drug prices. Now, we look at this thing and we think, well, what's the repercussions of all this stuff? What's it doing? You have an industry that is out there, and the drug industry, the pharmaceutical industry is always saying, well, it's because of research and development, right? We're doing research and development. That's why this is happening. Well, I thought, you know what? I'm going to look. Someone has to, right? I position myself as the Robin Hood of the healthcare field. Why? Because I'm going to look. So I decided, let's look. Let's look over the last 6 years and see what they've done. In a 6-year period, they've had about a 1% growth in research and development each year. 1%. Now I look at that and I think to myself, but you made 17% profit. You couldn't spend more than 1% on researching and developing new things to help lower costs, to help out humanity, to help out be a better overall thing? Nope, can't do that. But every time they're brought onto the carpet, every time we drag them out and we say, hey, look, you guys are overinflating your prices. You're overdoing this for a crappy system. Well, we spend all of our money on research. We spend it all on development. Well, guess what? No, you don't. It's proven. We can see it. You don't do that. So I look at that and I think to myself, well, then what are we doing here? We got a problem because it changes your care. It changes the care that physicians give to their patients. It changes your outcome if you can't afford certain things. Now they're going to look for other options. It financially has caused ruin for millions of people that need help. So we go back to this and we say, well, it's just wrong. Now why? Poor regulation. They're not a regulated industry to any great degree. Yeah, we talk about the FDA and this and that. All they're looking at is, hey, are we going to kill somebody with this thing? And we've got a whole other video on that. But we're looking at poor regulation, and we're looking at poor consumer awareness, we talked about, inflated prices, grotesquely inflated prices, and huge loopholes. They get tax breaks and tax incentives. They get ways to stop generic companies from getting into the market. They get orphan drug policies, and they get things called biologics that are very hard to copy. And they're patented for longer periods of time. So these guys get kind of a get out of jail free card all the time. But we're the ones on the back end that are suffering. And here's the facts. The healthcare industry in the United States is a $4 trillion a year industry. The average person in their lifetime will spend about $400,000 on their health care. You're going to spend over 80% of that between the age of 40 and the time you pass away. So you think about that. Now that's going to come out of insurance, it's going to come out of your pockets, it's going to come out of your premiums, it's going to come out of everywhere. That is a huge amount of money when the average household income is about $50,000. So just start doing the math on that. 50 grand is what I'm making for a household. I have 2.3, 4, 5 people per household. So my spouse and I are going to spend about $800,000 on our health care over our lifetime. Yet we make $50,000 a year. That means we're going to work a good third of our work life just to simply pay our medical bills. Guys, this can't happen. I mean, I don't know what else to say. It can't happen. And then we look at these drugs and we look at the costs of them, we look at what they're doing, and we think to ourselves, well, they're helping us, right? We're getting all these wonderful benefits. But then we look at the World Health Organization again, and we say that, look, what's the leading cause of death in the United States? Chronic degenerative disease. 88% of all deaths in this country are due to chronic degenerative disease, heart disease, stroke, cancer, diabetes, Alzheimer's. Not infections, not flus, not falls, not traumas. We've got a great system for that. But we don't do very well with chronic. We don't do well with chronic degenerative. Why? Because the model is wrong. It's a wrong model. It doesn't work for chronic degenerative care. It was never intended for that. Well, then you get all thinking, well, maybe it's just to keep us around. Who knows, right? Keep you unhealthy. Then you get to keep buying more. And the more you buy, the bigger the profits go. Right? But surely not, right? That could never be a thing. Now here's the real kicker. Of all the money spent on drugs globally, right? You're talking roughly almost 8 billion people. The United States has what, 340, 50, 60 million people? We are less than 5% of the entire globe's population. But we spend 42% of all the money ever spent on prescription drugs here. Less than 5% of the people are spending 42% of the dollars spent. That's insane. It's crazy. It has to change. I have positioned myself for 20 years to try to make a change, to try to help people get their lives back. Guys, it's time. It's time to take action. It's time to take your health back, but you have to know how. You got to learn. And you have to have someone or somebody that tries to help guide you along the way. The key to all of this is you've got to find the cause to why you're sick and tired. And once you find that cause, you have to then remove it. You have to nourish that body back to health. You have to be taught. A good friend of mine always talks about doctor being Latin for teacher. That's what it is. That's what it means. A physician is a teacher. It's a guide. It's a helper. That's what we do. But I can only do so much. So I need help. I need your help. If you guys feel something with this, if this resonates with you, think, hey, well, you know what? It's the Robin Hood of the healthcare world. He has to have a merry band, right? He's got to have his merry men and women. Share it. Share it with your friends. Let people know we're trying to do something. If you can do that, we can make a difference. I'm Dr. Sean. See you soon.